Thank you for inviting me along today. I'm sorry I'm not there in person. We have various bugs floating around our house, so we are quarantining at the moment to stay out of the way. So apologies if I have to pause for a drink at any point. So I'm going to talk about the Bioresource, an organisation that people within certainly England will be invited to join in the coming months. What we do, what that means for the Ring 20 population specifically, and how we have supported other research into rare diseases in the past. So we are a national recallable resource. So we're funded by NIHR, that's National Institute of Health and Social Research, which is an England body. So our funding is limited to England. So where you see a couple of maps soon and they only look at England, that's why. But there are ways we can work with the devolved nations as well. Our mission is to support human health research and shape that so that it leads to changes in medical practice to everyone's benefit. And we do that by enabling rapid identification of people who are eligible to take part in research studies, enabling the contact of those people, and also being able to help with some of the research activity itself. So it says here by genotype and phenotype. So we do work with genetics, and also phenotype being sort of your clinical information, what for a patient group, the information that determines their experience of their condition. So as I said, you can see our centres are across the country. We have a few in London, but we do try and cover as much as we can. And we will most likely be having some new centres coming on board by the end of this year. But we do have coverage around the country. And this is an overview of the different areas we work in, and that's so the disease areas in particular. So as it stands, we have over 200,000 individuals who have signed up to be a part of the Bioresource. So they come from the general population. So that's the people that we essentially don't recruit because they have a certain condition. They are people who have just expressed an interest in taking part in research, and a lot of them actually come through the blood donation service. So they're invited to join when they attend those appointments. We're recruiting across about 50 different rare disease areas in 60 or so NHS sites, and we've had 22,000 people join through that specific programme over the course of the past 6 years or so, I think. Actually, it might even be 10 now. That's just a slight jump, 10. And that's where Ring 20 would falls within our programmes. And then we have common diseases such as inflammatory bowel disease, mental health, and non-alcoholic fatty liver disease. And then, obviously, trend of the past 2 years, we have a COVID programme as well, where we responded to the pandemic with recruitment of over 7,000 individuals. A lot of those were healthcare workers, but also patients who were in hospital due to having COVID. And we also have Young People's Bioresource, which is a newer programme that includes people from age of 11 to 15, recruiting through schools primarily. But across our programmes, we recruit younger people, so up to the age of 25 is what we're classing young as. Sorry to anyone, including myself, who is over 25. You don't fit our definition of young, unfortunately. Particularly in rare diseases, we have a couple of specific projects that are on paediatric rare diseases in particular, but that's probably where we have the largest number of child and young participants. So the Ring Chromosome project itself, so we're starting with Ring 20, but it will encompass beyond Ring 20, hopefully. But the initial phase has been in supporting the Unravel study, which I think will be spoken about next. So some of you possibly in the room already have joined the Bioresource. We did this at our Cambridge and Leeds centres. So people just joined our standard general population Bioresource. and we collected our usual blood samples, and people filled out the consent forms, and that's enabled us to share some samples with Illumina so they can look at whole genome sequencing on those samples. The next stage is setting up the rare disease project for ring chromosomes. So that's been approved by our steering committee, and we're working to do the first sort of recruitment phase with that will be done alongside the natural history study. So that will be ring 20 patients. So we're getting the site approvals in place to make sure we can do that, and working with Alison and the team to sort out the logistics of it. And we're looking at ways we can extend beyond just ring 20. And I believe Alison's already spoken with the charity Unique about that. But we are aware of the limitations. In rare diseases, people aren't everywhere. People are in pockets of the country, or, you know, spread far and wide and in few numbers. So we're looking at ways we can not rely on our usual model of people dropping into their standard clinic in order to recruit people. We'll probably look at a referral system where you can self-refer, and we'll find the nearest place for you to go and join the bioresource. So the rare disease bioresource more broadly, what does it mean for patients and their families? So you're providing samples. These are normally blood samples. It's a relatively small volume of blood, and from it we can extract DNA, and then we can do, we don't do whole genome sequencing as standard. We do something called a genetic array. So we get a lot of genetic information, but, you know, it's still not all the pieces of the jigsaw. And then we store some sample as well in case that can be used for other research in the future. Also consenting for access to healthcare records. So we don't just take a download of everything that we can get our hands on to do with you as soon as you join the bioresource. It means that when there's a specific research question that could really be answered by compiling together healthcare record data from several individuals, we can look at the ways we can do that. So we work with NHS Digital. You have to go through approvals for them to pass information on to you, or working very, I guess, much more old-fashioned, or simply literally asking a member of a clinical team we work with to look in a hospital record for a specific result or something, if that's what we needed. And that people are happy to be invited to further research studies. So people in the rare diseases are most likely to be invited to research studies about their rare disease, but you could also be invited to studies that look in other disease and healthcare areas. We run a model by which researchers can request to access the data we have collected, whether that's from samples, healthcare records, or that genetic information, without needing further consent from our participants. So as part of the consent form, it says, you understand and are happy with that. And that just speeds up the process by which researchers can perform their analysis on data. In our rare disease cohort, there is the option to receive feedback on any pertinent findings. So that's where a piece of research has identified a genetic reason for someone's condition. At this stage, it's very unlikely that this will be something within the ring chromosomes cohort, but it is on the consent form. So I thought I would just mention it. It isn't something we have in the other areas of the bioresource. So as I said, we're recruiting across 50 to 60 NHS sites, and it's actually 63 projects currently recruiting. So again, you can see we're dotted across the country. So whilst you may not be seen in specific clinics, there should be an avenue to get you into the bioresource. And there are other ways you can get involved as well. We have a national volunteer advisory panel. So this is part of our patient and public involvement and engagement programme. We want people who are part of the bioresource and interested in what we do to tell us what they think we should be focusing on, how we should be going about doing things, and reviewing applications from researchers wanting to make use of the people, the data and the samples that are in the bioresource. And then we're working on a participant portal. That essentially is an online app where people will be able to see what studies their data has been used in. They'll be able to complete new questionnaires and things like that. So it's once it's up and running, it's hopefully going to be something that's very useful for our participants. So then to come to more of the processes in the bioresource, so we have two stages. We have stage 1 and stage 2. Stage 1 is joining the bioresource, the recruitment of our volunteers, whether that's through patient clinics, as I mentioned, blood donor appointments, just people getting in touch with us saying they want to take part potentially. And at that stage, it's consenting to join the bioresource, providing contact information and personal details, and providing samples. Stage 2 is where we help with the research, essentially. So we refer to that as recall, and that's contacting the people who've signed up to the bioresource to take part in further research studies that they match the criteria for. It might be because they have a specific version of a gene that makes them of interest to a researcher, not necessarily because having that gene means anything. They're just looking at its impact or lack of impact in a certain disease area, or because of some of their clinical features. It could even be because they have smoked or they haven't smoked. So it would be being invited to those studies or clinical trials, likely anywhere in the UK. Stage 2 also covers sharing of data and samples with researchers. So there's nothing new for participants to do, but what they've allowed us to do already through the consent process and donating those samples means that research can still take place. So that process is very robust. People have to complete an application form that is considered by our review committee, our steering committee. And where we work with industry, we have contracts in place, and we do work on a cost recovery basis with industry. So there's no profit there, it's just covering costs. And at the moment, we remain free for use by people working by universities or the NHS. So when we look at the applications that come through, we're looking at the science they're presenting to us to make sure that it makes sense, that that what they're wanting to do, they've justified that adequately. I have to say I'm not an expert on reading those parts of the applications forms. I'm not a scientist. I should have said that at the start. I'm not a scientist at all. We also look at the statistical justification. So if somebody says they want 500 people to do a study, they need to tell us why they need that many people. Or if somebody says they could do it with 2 people, they need to say how that would be enough people to prove anything, essentially. We're looking that we can actually provide what they want. People do come to us and ask us to find people with certain genetic variants and differences that we just don't have. It's so rare that even within 200,000 people, we don't have enough people. And then probably most importantly, we're looking at what the benefit to patients is. So that might not be immediate benefit, but it could, long-term future benefit, potentially immediate benefit, and what the burden is. Is it asking too much of people, or are they being compensated enough for what they're being asked to do? So I'll just quickly run through this because I realise I'm going over time. So this was one study that we did through rare diseases. We did used to do whole genome sequencing, and from that we could find people with genetic variants that indicate undiagnosed heart conditions. So we had a project that was specifically for patients with those heart conditions. So this was taking everybody else who was in the study for another reason and seeing if they had these genetic variants that might cause a heart condition. So the first thing we did was find out if people wanted to be invited to studies where they would find out things about their health that otherwise they would be completely unaware of, and they might want to remain unaware of, because simply by receiving an invite to a study saying, come and take part, we're looking at people with undiagnosed heart conditions, kind of implies you might have an undiagnosed heart condition. And once we did that, we had a very good response rate of people who were happy to be invited to that sort of studies. So of the amount we contacted, 94% were happy to be invited to that type of study. And then for the study itself, it was quite a small study. It was kind of a proof of concept study. So it was kind of looking at, does this, is what we're saying true? Are we seeing what we expect to find? So we had 11 people take part in the study, and 4 of them had the variant that could predispose them to these heart conditions. And it wasn't just about diagnosing people, it was about finding out what mattered to people and what their experience of going through that process was, so that information like that can be delivered correctly. So you can see there what the questions were that were asked. And I will leave it there because I'm over time, but please do let me know if you have any questions. I'm quite happy to share the slides. They have contact details on the bottom. I hope that's given you a whistle-stop tour of what we do and what it might look like if you are contributing to the bioresource, and do join. Thank you.